Give me guys 1 second, please. I'll be back. Hi, Brandon. I'm here. Okay. So, pin. Hello. I want to know which is um Sarko account. Can you send me un hi, please, to add you here in the live video? Okay. So cool. Okay. I think it's this one. Hi.
Hi. Hi.
I'm sorry about that happened
No,
sometimes.
it's
So
fine.
don't
Yes,
worry.
I don't know
So
what
we are
was. I was
here
like,
ready.
say
People
again.
as us waiting for us. So
Oh, no problem. No
yeah.
problem.
So today we are going. I'm sorry. My name is Lisa Alfaro, and I am part of the community health team. And tonight we are going to have here Sarko, the manager of data analytic in Whitman-Walker's research department, and she would be talking with us um, about how women are represented in the clinical trials and what SWAP's research community needs to fill going forward to ensure we archive gender equality. So, people, if anybody has any question, please leave me the comment in the comment section, and she is going to help us to answer any questions somebody have here in the comment. Okay, so Sarko, please introduce yourself.
Hi, my name is Sarko. I'm the manager of data analytics at Whitman-Walker. I use she, her pronouns. And I am the data specialist in our research department. So I manage our like data specific projects, work with our electronic medical record, analyzing our own medical record data or querying that data, and setting up data infrastructure as well so that we can do a lot of the amazing research that we do.
Great. So we are going to start with the question, Sarko. And Sarko, I am telling you the right pronunciation for your name.
Yes, yes.
Okay, great. So we are going to start with the first question, and the first one is: how have women historically been affected by research, and what happened when women are treated differently in clinical trials?
So women historically have been very much underrepresented in research, and this is something that has been present for decades. So this most acutely started in 1977 after we saw the effects of thalidomide in pregnant women. Thalidomide was a drug that pregnant women would take to ease nausea during pregnancy, and it caused horrible deformities in infants and newborns. And so that drug was put off the market, and that because of the devastating effects of that drug, that that prompted the FDA to put out a guidance saying that women of childbearing ability shouldn't be included in clinical trials. And so you see this massive disparity between men and women in clinical trials starting really then in the late 70s. There were also some misconceptions about women in clinical trials, that they were more complex or expensive research participants because of, the ability to bear children, because of hormones, just some different biological factors. And researchers were afraid that women would have a different response to drugs than men would. And so it would just make the research projects more cumbersome. And so you see that women were pretty much excluded out of clinical trials for a long time.
Good. Thank you for your answer, Sarko. So, what progress has been made since trial thalidomide? Thalidomis. I don't know if I'm telling you the right.
Yeah, that's thalidomide. It's kind of no problem.
Yeah.
It's a mouthful. So yes, that created a large divide in women being in clinical research, and there are other reasons too. Like researchers would tend to go to college campuses to recruit people for research projects, and a lot of times they would go after white men in particular. And of course, you still see some of that, but there has been progress that's been made. I mean, it's been recognized that doing clinical trials in women and testing for pharmaceutical drugs in both men and women is really important to understand how the drugs are going to impact them differently. So in 1990, the NIH established the Office of Research on Women's Health. And then in 1993, the FDA officially reversed that guidance from 1977, saying, yes, you should include women in research. It's actually really quite important. And you should look at sex assigned at birth as a biological variable that's included when you're doing analysis on a research project. So that was a turning point there, but it actually only quite recently in 2016 have we seen women not be the minority in research, and actually now they're the majority in clinical trials research. Data from 2015 to 2019 show that in the United States, women represent 56% of clinical trial participants, and throughout the world, it's about the same, I think like 53 or a little over 50. So the tides have changed a little bit, which is good.
Good. And what issue remain?
What issues remain? So while we do very recently have women representing the majority of patients in clinical trials, there's this massive disparity between white women and women of any other race or ethnicity. So clinical trials, women in clinical trials are overwhelmingly white. And so that's a major problem. We need to understand how drugs work in all the different type of populations we have here in the United States. When we're leaving certain groups out, like we just don't have the proper evidence to say that this drug works in this particular group. And looking at race and ethnicity is a really important factor in understanding how drugs work. And not to say that there's a like a biological difference in races, but all of the other kind of socioeconomic things that surround race are really important when we understand how people are taking drugs, what access they'll have to the drugs, how tolerable the drugs will be in certain communities, etc. So that's a big disparity, is racial disparities amongst women in clinical trials. Also, there is, as far as I could see, there's no recording or no embracing the difference between trans women or cis women or people who identify somewhere along the trans feminine spectrum. This data is just not collected. When I see, or when I was researching, women in clinical research, I think they're looking at sex assigned at birth as far as designating who women are. But of course, gender identity is a really important part of understanding how drugs work in certain populations, how accepting certain communities will be of certain drugs as well. So that's something that I just don't even think is on the radar of like the FDA, who really, helps to set guidelines for clinical research, looking at the difference between trans and cis women.
Good. So we are going to see if we have any questions. Somebody say hola, hi, yes. Okay. Someone, Alexa say, in which research are trans women included?
So there is more research happening in trans women now, which is really great. And this is really more of a recent phenomenon. Two large studies looking specifically at trans women are the LIGHT study and LIGHT Plus, and these are two studies that we're doing here at Whitman-Walker. LIGHT is looking at HIV negative trans women and trying to understand the incidence of HIV infection, or how many new HIV infections are happening in this group. And that's really important to know. We just don't have that data. And then also just understanding the other elements around HIV and risk for HIV. LIGHT Plus is a similar study. It's looking at HIV positive trans women and understanding their health outcomes in regards to HIV infection. Um, I know that Gilead, which is one of the sponsors, pharmaceutical sponsors that we work with, is also doing more work with trans women and being more inclusive of trans women in their research studies. One of the studies that we did here at Whitman-Walker, where we like made a quota for how many trans women we were going to have in the study. Like we made space to make sure there was a certain percentage of trans women who would be involved in that study to make sure that that data was included, was a PrEP trial looking at the newest PrEP drug, which is Descovy. That was the study that really showed that it was non-inferior to Truvada and was safe as another option for PrEP. So looking at PrEP studies and around HIV and kind of general LGBTQ health. I'll add that while there are more studies happening that include trans women, specifically include trans women, there's still, of course, a lot of work to be done. A lot of the research around individuals of trans experience tend to be focused like on HIV or STIs or mental health, which is good and important, but I am seeing and hope to see more research that's just really looking at the general health of trans individuals, like just knowing what's the best care for trans individuals, looking at gender affirming care and how that can really help improve the health outcomes of trans individuals. A few studies that we've done in our research department have looked at like primary care indicators for trans individuals, like blood pressure effects of gender affirming hormone therapy. So I think as the research community understands that this is an important population we need to be putting more resources into so that we can understand more, you'll start to see more studies that don't just look at transness or group transness into like a risk group, but really like just looking at the holistic health of trans people.
Good, good to know. Consuela say trans women are still overlooked in the health studies. And now we are going to continue with the next question. And how does Whitman-Walker help address to those concerns? What research studies are women participating in the Whitman-Walker health studies?
Sure. So I mentioned a few of the studies that we have women in, well, trans women specifically. So the Light study and the Light Plus study. Um, right now, as far as our records go, we have over 700 women that have participated in our research program. Um, Unlike many research institutions, we do record the sexual orientation and gender identity of everyone in our research program. And so we know that over 90% of the women in our research program are of color, about 28% are LGBTQ plus, and over 32% are trans or gender expansive. So we continue to make sure that we have studies where we can include women in. Like I said, in the case of the Discover study, which was looking at PrEP, we made sure that we saved space for trans women specifically for them to be in those studies. I think with Whitman-Walker generally, clinical research tends to be, even now, it tends to be like white men of a certain educational attainment who will participate in those studies. But with our patient population and just with the community that we have around Whitman-Walker, we have like a lot of great clinical research trials and social behavioral research trials, and it allows our patients to be a part of that research and a part of that contribution, so that when these trials reach their final conclusion, whether that be a new medication that's approved or new policies that are put in place, new programs that are developed, that our patients, including women, can be a part of that understanding of how to improve care or to improve policy or to put out different programs.
Yeah. So we are going to see if we have any question. If you want to add something to people who is watching us now, and how can they join you guys there in the research team? I mean, to participate into there. If you can tell someone how to do that, where can they find the information?
Sure, sure. Yes. If you are interested in research, we have a survey on the Whitman-Walker Institute's website, which is whitmanwalkerimpact.org. And you can find that through the main Whitman-Walker, clinic website if you're looking for us. But we have a survey there. You just answer a few questions about yourself. And then if we see if there are any research studies that you would be eligible for, we'll contact you. So feel free, don't hesitate to complete that survey. And we also have all of the studies that we're currently working on, and also and then any like studies that we're actually recruiting for. I saw one comment here, which is why I paused, that Whitman-Walker needs to focus on trans women in wards 6, 7, and 8, which I'm so glad you brought that up, because when we look at our women in women in research, most of them are coming from Ward 8, Ward 7, Ward 5, and Ward 1. And so we actually have quite a bit of women, especially from Ward 7 and Ward 8, who are involved in our research projects. And again, it's like a really excellent opportunity to involve people who may not have access to research projects to be involved in this kind of work. And as we expand over, in the Southeast area, like with our new clinic coming up in a few years, we'll also really be expanding research there too, and really trying to outreach to even more people in Ward 7 and 8 and 6.
Yeah, we are going to be there as soon in the southeast area. I think in 2023, right?
I'm sorry, say that again?
We are going to be there in 2023.
23, yes,
Yeah,
yes, yes, a couple of
yeah.
years.
Somebody else is asking you, just making the work inclusive. Love it. Oh, thank you. So, and do you have anything else to add to the people who are watching us now? And there is another question before you leave.
Sure, sure. I guess my last, note will be, if you do have questions about research, um, maybe have some apprehension about research, which a lot of different communities do, like certainly the communities I'm a part of, there's a lot of apprehension about research. We do have avenues for community members to be involved in research. We have community advisory groups. And so that's an opportunity for the community to come see what we're doing, give their input. Sometimes we need to understand, how does this research study sound to you? What do you think could be improved or be better ways to do outreach? Or if you just have general questions and want to speak to some researchers one-on-one, we're also open to do that too. I totally recognize that research, for good reasons, is scary and not doesn't feel like a trusting relationship for a lot of people. And that's certainly something that we work to try to address at Whitman-Walker and with our research program.
Great, Sarko. So thank you for being with us tonight, talking about your what you're doing there with us here. So thank you for being here, and I hope to have you here soon again.
Thank you so much for having me. Thank you,
Yeah, of
everyone.
course. Yeah, I just have some stuff to tell. You can, if you want, you leave if you want. So one last thing, if I'm going to talk about COVID-19 pandemic, if you want to get vaccinated, there are a dozen of walk-up sites through Washington D.C. where you don't need an appointment. You can use go and get your vaccine. If you want to get vaccinated with Whitman-Walker location, you can use call us back at 202-207-2480 or email us appointment at wilmar/walker.org to schedule an appointment with us. Also, we will be registering people for the vaccine out the outreach event too soon. If you already got vaccinated, you congratulations. You are part of to finish this pandemic. The CDC has given you okay to relax some of you mask wearing and return to some pre-pandemic activities. However, it's totally understandable why you may want to keep wearing your mask. And the vaccine is not 100% effective, but there are no protocols to in place to actually verify that folk around are vaccinated or you have been approved, gotten the use to do it. So if you have not been vaccinated, please continue to follow the CDC guidelines for mask wearing, quarantining, social distancing, and the lie is very important that you get vaccinated because COVID precautions measures with those around you. Be mindful of mask and keeping you distancing, especially when you don't know whether a person has been vaccinated or not. So also remember to follow us on Instagram, Facebook, Twitter at Whitman-Walker and checking our website whitmanwalker.org for most update information to our services and for more COVID-19 resources and general Whitman-Walker services. Please call us at 202-797-4439 to make HIV or STD appointment if you want to be tested. And there is some more information. You can find us and as I told you, Instagram, Facebook, and Twitter. So thank you for being with us tonight. And I hope you see you next Wednesday. Thank you. Consuela, abrazo, mi amor.